the commonly used hydroxychloroquine and azithromycin has been used in over 300,000 older adults with multi-comorbidities. The CDC states that hydroxychloroquine can be prescribed to adults and children of all ages, and it can be taken safely by pregnant women and nursing mothers. Madam Speaker, there's certainly many different takes on this drug, but to question the safety of it is just amazing to me. Different studies have popped up, and some of them have tracked back to organizations and individuals who have a money interest in avoiding the use of a low-cost, readily available, widely used drug, and in favor, instead, one could speculate that their preference would be a profit motive, in as much as some drugs are available at a much, much higher price, and ones that perhaps are less effective in treating this drug. I'll wrap up by saying, Madam Speaker and members of the body, that on the front lines, doctors are treating patients in the United States and elsewhere. These doctors and patients are those doctors who have helped beat COVID-19. They have publicly espoused the benefits of early treatment with this HCQ. But there are many people alive today because of this. Again, this has been around for over 65 years, and now the Virginia government is discouraging the use of HCQ and stigmatizing those who choose to prescribe it. This is meddling by the Virginia Department of Health, and it violates a longstanding principle that gives an individual final decision-making authority in matters concerning one's own body. Patient-doctor decisions made between two consenting adults regarding a person's treatment of a life-threatening condition should be respected. There are numerous people in positions such as the ones we hold, Democrats, Republicans, who have come out publicly praising this drug, and in the interest of time, I'll skip over quoting those individuals. Again, I'm going to go to the resolve portion of the resolution and just remind the body that I'm not asking for an endorsement of a specific drug. I think that would be inappropriate. But I think we can encourage that it should be made available for treating COVID-19 in the Commonwealth, both prophylactically and as a therapy, immediately after confirmed or suspected exposure to COVID-19, when that's made by physicians providing patients with informed consent concerning a particular regime of hydroxychloroquine to be described. So, Madam Speaker, with that said, again, I know there's many points in this that can be disputed. Studies can go either way. I think the overwhelming abundance of studies have supported the safety and efficacy of this drug. I think we all want to see an end come to this public health crisis, and one of the ways that we can do that to help prolong the lives of our friends and family members, maybe even fellow members of this body, is to avoid meddling in the decision-making process, or allowing our Commonwealth to meddle in the decision-making process whereby people make their own medical decisions. With that, I'll conclude. Thank you, Madam Speaker, and I hope the members of the body will support this resolution.
Thank you, Delegate LaRock. The delegate from Fairfax, Delegate Simon.
Madam Speaker, speaking to the resolution.
Delegate Simon, you have the floor.
Madam Speaker, I will be brief. It's late, and we've been here for a long time, and I promised my colleagues I wouldn't spend a lot of time on this issue. I'm not going to spend a lot of time talking about the fact that the Henry Ford Clinic study that the delegate referenced suffers from the exact same criticism that the studies he critiqued on line 46 of his resolution suffered from, which is that it wasn't. It was backward looking. It was observational. It wasn't randomized. It didn't have any of the safety and normal protocols that would be used for a study. I'm not going to talk about the fact that the Yale professor that he mentioned in his resolution has a note now on his bio on the Yale page where the Yale medical team sort of distances themselves from him and says that he really doesn't speak for the medical department there. So I'm not even going to talk about those things. I will mention that the FDA has revoked. We have a lot about how the FDA has approved hydroxychloroquine in the resolution. It's a little bit deceptive the way that that's put in there. They say it's been approved, and then they say that off-label use is often done, and it seems to suggest in the resolution that hydroxychloroquine has been approved for off-label use when in fact it has not. The FDA specifically revoked its emergency authorization for use in treating COVID, noting that it has resulted in serious heart rhythm problems and other safety issues, including blood and lymph system disorders, kidney injuries, and liver problems. Let's be real. The reason that this resolution is on the floor today, the reason that this resolution was introduced is because Donald Trump has talked up the benefits of hydroxychloroquine. And the delegate who introduced this wants to associate himself with the comments and the remarks of Donald Trump, who said, what do you have to lose? Take it. I really think they should try it. Try it if you'd like. Right? That seems to be that. What do you have to lose? And that seems to be the theme here. Although, again, I will take exception to Delegate LaRock's description of the resolve. He says we don't endorse it, we encourage it. I'm not sure that that's a distinction with a difference there. When we say we encourage it to be made available, I think that sounds like a government endorsement, particularly if we do it through a House joint resolution. And the reason he wants to do that is he wants to show his loyalty and his fealty to Donald Trump. And the Republican Party here in Virginia, I think, wants to do that. In fact, there really is very little distinction between the Republican Party and Donald Trump. At their recent convention, they didn't even adopt a party platform. The 2020 Republican Party their platform is whatever Donald Trump says. And if he says hydroxychloroquine is good, then by God, it's good, and we ought to be endorsing it at the state level. Madam Speaker, that's what this vote is about. And one final thing, all this talk about hydroxychloroquine does have danger. There really is a real danger, which is that by having the Trump administration ignore Dr. Fauci, ignore the experts, ignore the FDA's guidance, and push their own politically motivated agenda, it's causing problems. Already, we've seen public health surveys that say people are nervous about taking a vaccine when it becomes available because they're worried that the testing is going to be short-circuited. They're worried that the FDA has been influenced politically to approve it too soon. And we all know the best way to get beyond this problem is to get a safe, effective vaccine and vaccinate as many people as we possibly can. And efforts like this one to promote junk science and hydroxychloroquine because the president says, what's the harm, are going to hurt those efforts in the long run. I hope it's a pleasure of the body to vote no on this flawed and misguided resolution.
Thank you, Delegate Simon. Shall the resolution be agreed to? Madam Clerk.
Madam Speaker, I'll call the names of those I don't see voting. Delegate Adams, L.R.
Adams votes yes.
Delegate Adams votes aye. Delegate Austin. Delegate Austin has voted. Delegate Cole, J.G. Delegate Edmonds.
Delegate Edmonds votes aye.
Delegate Edmonds votes aye. Delegate LaRock. Delegate O'Quinn.
Madam Clerk.
Delegate LaRock.
Delegate LaRock votes aye.
Delegate LaRock votes aye. Delegate O'Quinn. Delegate Sumaira. Delegate Wampler. And Delegate Wright is absent.
The clerk will close the roll.
Ayes 29, nays 65, abstentions 0.
Ayes 29, nays 65, abstentions 0. The resolution fails to report.